Good morning, Dr. Lipo. Back from vacation. I had 3 weeks off, but I posted during the time, just results. But now we're back in action. We got a busy couple of months. And then in June, I'm going to Colombia to a meeting with Alfredo Hoyos for, advanced body contouring. But today, I've got this 24, and it's Monday, by the way, just after Easter Sunday. 24-year-old from Los Angeles, California. He's a model here. 24-year-old from LA, California. Flew in last night. I saw him last night. Come over this way with Gynecomastia, and we're going to do what I say, Gynecomastia and beyond, because it's Lipo gyno, but don't concentrate on gynecomastia. I concentrate on male-specific plastic surgery. But nowadays, I've been doing what I call gynecomastia and beyond. This gentleman, he's doing gynecomastia neck to nuts because he wants it all shaped up and nice. He's asymmetrical, this right side, and he told me this was always bigger than the left side, even when he was a kid. And you can see it's more volume here. We're not going to do pectoral lipofilling. It's make a muscle. He's got enough up there. Again, this side, I can do a tiny bit on this side, but something? Difference in sides are natural, and that's what makes things perfect. As you can see, make a little crunch. For some reason, he's got asymmetry of these bubbles of fat and six-pack abdomen, so we're gonna fix that and make it nice. A little bit hollow. Maybe he's got a little pectus excavatum on this side compared to this side. This nipple's a little bit bigger. I think. Remind me, we just discussed we're just gonna throw in a nipple reduction on that. On both sides. Because I do one side, he's gonna come back and say, "Doc, I love this side now. I gotta fly from LA to you to do a nipple reduction." Which he could, but we're gonna take care of it all at once. Get all of this side boob out of here and create space here between the pecs and the lats. Go on down, turn him on his side, get the lower back. He doesn't have much fupa there, but we're gonna hit the fupa a little bit because I need to break up this line here and get that great V to P, that midline linea alba and the semilunaris. Etch a little bit of the six-pack. Nothing crazy. He wants me to kind of tone it down, and I don't know how to tone things down, but we'll put a leash on me and tone me down a tiny bit, somehow, some way. But he doesn't want those rock-hard abs there, but we're going to whittle it down and give him just a hint, too, so I can kind of make him symmetrical. Stealth incisions, armpit, nipple, belly button, groin. He wants me to go as low as I can. We'll get couple liters out of them at least. No pectoral lipofilling. Renuvion J plasma to tighten everything up. And I'll talk to you about Renuvion. There's some controversy on that, but we'll talk about that and the FDA approval for that. Stealth incision, guaranteed results, local anesthesia. Let's hop to it.
That's nice.
From my house. All right, so let's start marking them. Midline, boom, all the way down here. So what I'm doing first is framing him. So doing the outskirts of what I want to do. Of course, get way back there. Lift up there. Outskirts of what I want to do. Get way back here. Now get over here a little bit. I want to just kind of, get this so I can even that up. Suck in your belly. There you go. The V to P, as I call it. Right here. Good. And that'll be the lower part of that, and that's what I call the lower box. And then I create shadows. It's my kind of signature thing I do. All right, come on down here. Let's see where your pecs are. Make a muscle. Perfect. Yeah, we got it. I don't have any definition there. Make a little muscle there. Yeah, see how it's wide there. That's beautiful, actually. Good. And the lats. Push your arm down on my shoulder. Push down. You pushing down?
Yeah.
All right. There you go.
You're pushing down towards the...
Yeah, push down again.
Like hard?
Yeah.
Okay.
I just want to see where the lats are.
Okay, good.
All right, relax. All right, now, let's see. So this is kind of a thing here. So I'm going to even that out here because he's got nothing on this side. Now, stand up straight. You're hunching. That's all right.
That's what Gino does to you, makes you...
I know, you're hunching. And that's what I got to tell people that, hunching is bad. All right, so that's a pack here. That's a pack there. And I kind of see something going on here. You know, something nice. Again, this side is fuller than this side. But when I'm in there...
Can I ask you a question?
Uh-huh.
So, you know, you mentioned the 6-pack. Obviously, you already know what to do at this point. But I just don't want it to, you know.
No, I know what you're talking about.
Because you mentioned this side was like bigger, and you maybe do some filling, or I don't know.
No, I'm not.
Okay, got it.
Yeah, no, I'm not. I'm just gonna work a little bit more on this side. You can see this is a little bit more, you know.
It's not that bad though.
It's not that bad, and you know, a little bit of difference in the size makes things natural. It's almost like people getting, you know, veneers on their teeth. You don't want to have like, you know, chiclets shaped. You want a little difference to make it look normal and natural. That's what I'm going to do for you. I'm pretty perfect in what I do.
Right.
This side's a little bit bigger than the other, obviously, but we're going to maintain the volume there. I could put in a couple, you know, like 150 or something here, but let's not. Now, lift up here. Let's see where the serratus muscles are. Doesn't really have any, so we're gonna create a little bit of line there. Just a little bit of interest. That's all I call it. A little bit of interest, shadow, so he's not blobby. Okay, get around here, get around there. Okay, so let's change colors now. You up. You alright? Alright guys. So now we're gonna numb up through my stealth incision a little bit longer. Alright? Yep. Good. Where I want to be. Now we're getting into the belly. See right there? Boom. There you go. So with me, you know, I'm a Gynecomastia surgeon, but yeah, I'm in the belly. So, but lately, I've been doing, you know, again, if you're 14, 15, 18, 21, you have just a gland. You're fit, we do the gland removal, but my claim to fame is what I call the Gynecomastia and beyond. Now we're gonna go to its back. Guys, so now we're doing the Vaser. He's all numbed up. We gave him some time to relax and get that numbing all in there. It's local anesthesia. So first thing we're doing is the Vaser. I got the 2-ring. Standard is I do the 2-ring. It comes in 1, 2, 4, and 5. But I like the 2-ring, 70% inside my stealth incisions. And here we go. And we start to melt this fat and melt the gland. Go. Perfect. Do you hear that inside you?
Yep.
Yeah, that's the ultrasound.
Sounds like one of those things you keep to keep cats and dogs out your front yard.
Is it?
That's what it sounds
may
like.
be. And I also go for feel. Because I'm melting this gland and the fat of the chest. Spend some time right underneath the nipple and carve the lateral pecs. in about 15 seconds, I'm going to go and head it towards the lats. Perfect. I use my smart hand to feel everything. Feel the resistance and feel the anatomy.
2 minutes to go.
Good. Now, at that 2-minute part, we're going to go towards the lats. Now we're going to go down to the belly. Start with the lines. And then we do lines first and then shadow second. So start with the semilunaris. On down. Create some lines there. So another 4 minutes. And now we're going to go down laterally. You feel anything? Maybe not.
Just a little thing here and there.
Yeah. Remember with local, you're trading off, getting off this table and getting something to eat versus general where you're nauseous and throwing up and it melts the fat and melts the glands when I did the chest, and had some heat there, so it's got a, kind of off-label, if I can say it. I don't mind saying it, but it heats up the skin, has some skin tightening properties to it also. So we're getting this, using my smart hand to feel, and then going all the way around. I can feel at first when I started it was had some resistance. Now it's like butter, like Philadelphia cream cheese. All right, so 2 more minutes to go. So now in the end we're going to head up towards over here. And heat that up in preparation to lipoing the lower box. Again, through stealth incisions, not haphazard incisions, which are terrible. These incisions are stealth, meaning when they heal, nobody's going to see. Obviously, there's little millimeter cuts because I gotta get in there and do what I'm doing, but they're very well hidden. Around to the belly button, very important. Gonna make them an innie to an outie. All right, guys. So here we are in the self-incision using my long instrument. It's a 4mm Mercedes, but instead of being 30 centimeter length, it's 40. I have these made a little longer. And it's gently curved, about 20-degree curve, to get around and curve him. So what I'm doing first is I go into the one self-incision in the armpit, and I really work this out good. Get around, get a lift up, get around. So this is curved, see? So it's a little bit curved, and it's long. It's 40 centimeters instead of the usual 20, and this way I can get way around the sides. This, with me, it's about everything, and I tell people that all the time. When they say, "Oh no, doc, all I want is zone 1 or zone 2, whatever the zone system is." I don't do zones because with me, it's about the whole picture. So I don't do that. And I don't even do grades. I don't do grade 1, grade 2, because that's old, abbreviation of to consider what a gynecomastia is with me it's either gland removal or liposuction and gland removal. And gland removal is really for the younger people. 14, 15, or 21, great shape, but most of the people need a little lipo and everything. Yeah, go for it. So what I'm doing now is just spending time in this negative space here, getting underneath this gland. A little bruise here because I noticed that when he came in. He says, yeah, I keep on touching it, squeezing it, and that's what people do. They're obsessed about it. Yeah, you can, what's that? Yeah. What's that? Oh, the Renuvion? Yeah, give him the Renuvion. Why not? So I'm taking right in this negative space here, in that armpit. And with a little curve, I can scoop and curve around beautifully.
That to go underneath your tongue. Alright. Also wet as the towel. There's something wrong doing? Good.
You okay?
Yeah.
Good. Getting all the way around here. This is amazing work. And I lift up here so I can really etch the latch here. Use my smart hand, give some pressure so I can etch this muscle and leave volume where I want it, like the lats and the pecs, and even add volume where I want to enhance, and of course extract volume where I don't want it anymore, like this beautiful triangle. And you can see already what I'm doing here, how the latch is starting to pop. Right there, you can already see it. Okay?
Alright.
Good. That's where I'm getting to the mid to lower belly and the sides. And I'll take it up, do from the top down and from the down up. You okay?
Alright.
Good. Nipple incision, and start getting this. So here, I'm etching this, the inferior aspect of the pec muscle. And remember, the right side was freakishly bigger than the left. Right? Was it freakishly bigger? So we're calling you're calling yourself a freak?
Sometimes.
Sometimes. It was freakishly bigger for some reason. Now with the nipple a little lower, I can get, so see where I am? Way to his hip here. So I go from top, middle, and bottom to get very different areas without incisions all haphazardly around. Gland. Get into the armpit a little bit, huh? Yeah. I can etch this volume between if we're not doing any pectoral lipo filling, So I want to give them a little interest up here. You all right?
Yes, sir.
Good. I numb that area up. And now I'm doing the midline here. Sucking your belly a little bit. There you go. So I can see exactly where I want to be. I'm going to whittle it down, so make it not too dramatic. Now, at the lower part, and I'm just inching up the semilunaris up from below. Alright, so now I've lipoed the right side. I still have to do a little bit on the back. Just give him a little bit more local there to just numb that because I'm gonna go way to his lower back. So while that's getting numb, I'm just going to get this gland out. And this is a little bit bigger side. A little bit of fat. Notice there's no bleeding. So the technique and my extensive research on what to use. And you can take that away. Good. So now that is out. He wants a no nipple reduction on him, all said and done. So we're gonna of course do that. Floaters that are going around in here. And a lipo underneath this again. Little floaters like that. Again, you put it in. Just wash it out. Pull it out, and the little attachments will come out. Perfect. There you go. Feel around. Feel a little gremlin right there. See that little gremlin? Right there. There it is. Oh. There it is. There he is. Here's the gremlin. There. Nice. His name was Freddy. Say, Freddy got fingered. All right, done. That is great. So now we gave it time. So the gland's out. We gave it time for the little lipo, We're doing Renuvion powered by J-Plasma. It's helium gas with a radio frequency spark at the end, and this heats up the undersurface. It's you know, FDA they're asking FDA now for to be approved for skin tightening. Right now, I can off-labelly say it's skin tightening, but on-label it's for coagulation and stopping of bleeding, and it's heat. It's radio frequency with helium gas. And in the right hands, like me, let's do this, 10 times a week. It's an amazing tool, and I've seen amazing results. So here we go on there. I think 1.5. And remember, I can always see where I am. Any instrument in the wrong hands is dangerous. In the right hands, it's perfect. And I think this is an amazing tool, produces amazing results, and I think it tightens the skin amazingly, no matter what other people say. So what I'm doing now is just closing up the nipples, internal stitches, just 3 of them. One in the center. One on each side, very simple. Nothing to come out. So I'm making his nipples purposely small, as they've been sticking out for his whole life. And a little bit of scar tissue will form, as it always does. One of the biggest things about gynecomastia surgery, you gotta resist or inhibit that scar tissue from forming. But it always does, and we always sometimes have to fight it with steroid injections or massaging and rolling and compression garment. But it's always going to form a little bit. So this side, one more stitch. And we're done. And the other side's a little bit smaller, so a little bit smaller of a nipple reduction. You can put that arm down. I'm not going there yet. And then you'll put the left arm, right arm down, and you'll be fine. Good. Nice. Lipo Gyno, very beautiful case, 24-year-old gentleman from Los Angeles, California. We did neck to nuts, we did Vaser, high definition power assisted liposculpture, gynecomastia gland removal, nipple reduction, bilateral nipple reduction. We, as I said, went from neck to nuts, etched, defined, revealed, and contoured the pectoralis major muscle, the lats in the back, bring that all the way up there, the lats in the back, down through stealth incisions in the armpit, the nipple, belly button, in the groin. We did the midline linea alba, the semilunaris, going down to the V to P. Now again, sucking your belly there, that six-pack that we created, 2, 4, and 6, and the horizontal inscriptions that we defined and contoured all the way down to the hips and the lower back. Look at the negative space between the pecs and the lats. This is done with perfection under local anesthesia, and we did Renuvion J plasma to tighten everything up again through these same stealth incisions. We put in, we got out almost 6 liters of fat, from him, from all the different areas that we did, and the glands and the nipple that we removed were not that big. Come on over here. But the right side nipple was a lot bigger than the left side nipple. So we did both nipple reductions, gland removal, we did it all. So if you have gynecomastia, call me Dr. Lipo, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Thanks and see you soon.